Hello mga ka-Simply Nature! Please follow our social media accounts, our Facebook page, Simply Nature International, our IG account, Simply Nature Inc., and of course, our YouTube channel, Simply Nature. Don't forget to subscribe and click the notification bell for more updates.
Hi everybody, welcome to another episode of Simply Heal, and today, this afternoon, we have again with us Dr. Jansen. Welcome back to the program, Doc.
Hello, Sean. Hello, everyone. Glad to be here again.
Alright, so we've been covering a whole series of cancer that is female-oriented.
Yeah.
we talked about breast cancer for at least 3 episodes, right? We talked
Right.
about mastectomy, mammograms,
Yeah.
DNA, whether it runs in your family or
Yeah.
not. And today we are continuing with that female slant. All right, we are going to talk about cervical cancer today. In fact, cervical cancer, according to the statistics, is the second leading cancer for ladies in Philippines.
Yeah, correct. That's correct.
So, okay, let's jump into the topic. So if you have loved ones who I'm sure all of us has a mom, and many of us have sisters and daughters. So I think this is something, a good topic. Hope we learn something. You will learn something this afternoon. And let's start with an interesting tidbit. Doc Jansen told me that this is one cancer that you can get vaccinated for.
Yeah.
That you can actually prevent this cancer if you got vaccinated.
Yes.
So Doc, what's cervical cancer and how come it can be vaccinated?
Okay, cervical cancer is, simply put, no, it's a tumor that grew in Tagalog, sa kwelyo ng matres. So it's in the cervix. Okay, so the cervix is located between the lower part of your uterus and the upper part of your vagina, or your vaginal canal. Okay, so we have something called the endocervical junction. That is where your cervical cancer originates from. Okay? So it is primarily caused by a virus. It's called the human papillomavirus. So since it's caused by a virus, you can get vaccinated for it in order to prevent you from getting cervical cancer later on, which I will discuss in a while.
So
Okay.
how we proceed today? You're gonna share with us what causes cervical cancer?
Yeah. So, like what I've said a while ago, the human papillomavirus is the causative agent of cervical cancer. But it doesn't necessarily mean that once you get infected with HPV, then you will get cervical cancer immediately. Okay? And not only for women, the human papillomavirus is also the cause for your anal cancer, your rectal cancer, your penile cancer. So for men, so
it's
that
the
is
same
also,
thing.
Yeah, it's the same thing. It's very significant as well.
Okay,
So yeah.
I'm listening now. I'm listening now.
Okay, so this is not only for women but also men as well. Okay. So how come it's not necessarily that way? No, it's because most HPV infections in male, in women, no, have little long-term clinical significance. So 70% of women clear the infection within a year, and more than 90% in 2 years. So you can just imagine, no? So our own body clears up this virus on its own. So our immune system fights it. Okay.
But is HPV very common? Statistics that your slide said that 50 to 80% of sexually active teenagers and young women are actually positive for HPV.
Yeah, that's very true, especially
Wow.
when you are sexually active, because HPV is transmitted sexually. Yeah.
Okay.
So if you are really
So
sexually
it's
active,
almost 8 out of 10.
it's
wow.
yeah.
Okay.
So yeah, the prevalence is really high in getting infected, but you know, it's actually in your lifestyle whether or not this progresses to cervical cancer. Okay. Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. So here are some of the risk factors that can increase your chance of getting cervical cancer. So number one is if you have a lot of sexual partners. Okay. Another one is if you engage in sexual activity at a very young age. All right. Some HPV can also be carried by sexually transmitted illnesses, the bacteria of sexually transmitted illnesses.
Oh.
So that would be your gonorrhea. It can carry HPV as well. Okay.
So actually, cervical cancer only comes from HPV.
Yeah.
Wow. So that's it's like a single cause.
Yeah.
We can identify exactly how you develop cervical cancer.
Majority, actually, at least, I think it's at least 95%. Yeah, at least 95% HPV is the cause, because there are other causative agents like DES. DES is diethylstilbestrol. So that is back in the old days, a few decades ago, I think in the probably the 50s or 60s, they've been using that substance in birthing assistance, of birthing. So that chemical can actually cause cancer, cervical cancer, not only cervical cancer but vaginal cancer as well.
So actually, cervical cancer can be prevented since the cause is highlighted to one. I mean, one major cause, and it's HPV.
Yeah.
And if we can manage HPV, you eliminate cervical cancer.
Yeah.
And yet, it's the number 2 leading cancer in Philippines.
Yeah.
Sayang, ah.
Yeah, it's very ironic, right?
Yeah.
To think that we're a Catholic country, so the teachings is actually to be monogamous, but reality is no, it's not happening. Okay.
Okay. What else? What are the other risk factors?
Okay, so another risk factor is a weakened immune system. Smoking and again, exposure to the miscarriage prevention drug, DES. So later we're going to be zeroing in on the influence of your immune system on the occurrence of this cancer. Okay, so next let's move on to the vaccine. Okay, who should take the vaccine? It's actually both men and women.
Even men.
Yes, even men.
Men should get vaccinated. Wow, HPV.
Men are the carriers of HPV.
Also, the women can blame the men for cervical cancer because we are the. Oh wow, okay.
yeah. It's the men who are the carrier. But of course, if you as a woman you are highly active sexually, right? And then if you have multiple partners, then of course you can be a carrier as well, right? So in order to prevent cervical cancer, number 1 is HPV vaccine. Number 2 is screening. You have to undergo pap smear and the HPV DNA test. And number 3 is lifestyle intervention. Okay?
For the vaccines.
Yeah,
let's
for
go
the
to the
vaccines
vaccine.
first, we have actually 3. Previously, we only have 2. Okay? So that is your Cervarix and your Gardasil. Right now, we have Gardasil 9 already. So I'll be discussing the difference between the 3. First, let's go for the Cervarix. So Cervarix, it is a bivalent vaccine.
What's bivalent?
Bivalent, it just means that it has 2 strains of HPV contained in it. So you form immunity against 2 strains of HPV.
Okay.
Okay. So for the vaccine schedule of this, it's 0-1-6. It means that for your second dose, that would be a month interval between the first and the second, and then 6 months after the first dose. Okay,
so it's 3 injections.
Yeah, it's 3 doses.
And then that's lasts for the whole life.
Yeah, that's a lifetime immunity. Okay, so for Cervarix, the age range of those who is qualified for vaccination for this vaccine is 9 to 25 years of age. Okay, if you are more than 25 years old, would you be qualified to get this vaccine still?
Okay. Why is there an age?
It's an age, right?
Maximum.
Yeah. It's because the study that they've conducted this vaccine in is the population of those participants are between 9 to 25 years old. They haven't tested the efficacy of the vaccine for those who are more than 25 years old. So that is why. And then why not younger than 9? Because the vaccine is not effective for those who are less than 9 years old. So that's the meaning of it. Okay. Now, if you are asking, what if I am already, for example, I'm already 35 years old, 35 years old. Is there still a chance for me? Of course. We have Gardasil 9. Okay. So, for Gardasil, both the regular Gardasil and the Gardasil 9, the schedule is 0 to 6. So the only difference is the 2. So you get your second dose 2 months after the first dose. Okay, so remember that. Now, the difference between Gardasil, the regular Gardasil, the Gardasil 9 is the number of strains that you get immunized for. So Gardasil protects you for four strains. So that is why it is quadrivalent.
Quadrivalent, all right.
So Gardasil, the regular Gardasil is for male and females who are 9 to 26 years old. Okay? And then for the Gardasil 9, this one is non-avalent. That means you get protected from the 9 strains of HPVs.
Wow.
So this one actually even protects you from getting warts. Because the warts...
Like genital warts?
Yes, genital warts. Because genital warts, the causative agent of that is also HPV.
So it really seems like for the viewers out there who are single and not married, and are sexually active, it seems like you should go for HPV vaccine.
You should.
Is there any downside? We are in a vaccine season because COVID-19 vaccine, right? There's so much discussion. Now, are these 3 vaccines like any of the COVID-19 vaccines, or they have been tested for?
Oh,
okay. What's the difference? Because
okay,
the safety wise.
This has been in existence for decades.
For decades.
It has been studied extensively already, and I myself had the Gardasil vaccine.
Oh,
yeah, I did 3 doses. I only felt heaviness on my arm on the injection site, nothing else. Even with the other patients who are asking me to give them this vaccine, only pain on the injection site. It's like
so it's absolutely safe, like your BCG. There are no long-term side effects. There's nothing to worry about. No mRNA or anything.
No. This one is actually the HPV. Some portions of the HPV virus itself, in order for our immune system to recognize that virus.
Doc, so does this mean that if you are above 25 years old, you won't get HPV?
You still can.
But the vaccine, there's no vaccine. There is Gardasil 9 now. Okay. So if you are above 45 years old and you don't have HPV and you're still going to be active, so there's no protection that you can get?
You can still get vaccinated for Gardasil 9, but the efficacy will not be as strong anymore.
Okay.
Yeah.
So basically, there's an option all the way to age 45.
Yep.
So to all our viewers out there, Gardasil 9, right? Just remember that name. Go and look for your physician. You can look for Dr. Jansen, all right?
And it's always good to talk it out with your physician whether or not you are a good candidate for this vaccine, whether your lifestyle still warrants it, right?
How much is the vaccine? Is it expensive?
Oh, it is expensive, especially for Gardasil 9. The Gardasil 9 actually costs around, this is a ballpark figure, it ranges around 6,000 to 9,000 per dose.
That's per dose. So 3 doses will be about 18
to 20K.
20K, all right.
20K,
I think
20K.
Yeah, I think that's really fine if you, because when the statistics say that cervical cancer is number 2 killer for female cancer, I think, and it's 100% avoidable because if you have the vaccine. Sayang.
It's a good investment.
For sure. I mean, 1 chemo session is already your 3 vaccinations,
doses,
right? And you don't have to suffer the cancer scare or anything.
Right.
Yeah, so I think this is where I'm a pro-vaccine now for this HPV thing.
Yeah.
Oh wow, okay, that's great. All right,
so let's go to the Pap smear, no?
This is a detection or what?
This one is the screening that we conduct for women. Okay, so this one is primarily done by your OBs, OBGYNs. Okay, so what is the age range for this? No, it's women aged 21 to 65 years old, and this one is done once every 3 years. Now, so this one can be done with HPV testing, HPV DNA testing as well, which is done every 5 years for high-risk individuals. But some OBs might argue that as soon as a woman gets sexually active, then she can already go for the Pap smears. It's also valid, but you have to talk with your OB. But in general, the guidelines is this one.
For how much is a pap smear?
It's really cheap. It costs less than 300 pesos.
Oh, less than
Probably
300 once
yeah.
every 3 years.
Yeah, you
Go
did
for a
it-
pap smear.
Yeah, you do it once every 3 years.
Okay,
for
so if you don't
protection.
want to get a vaccine, which I think is a better investment, honestly,
Yeah.
because you are protected,
Yeah.
go for a pap smear.
Mhm.
All right, okay. So what can be done if you are HPV positive? Oh, wait, there is a restriction for pap smear?
Yeah. For pap smear, we have some restrictions. So it is not done for those who are younger than 21 years old, those who have underwent hysterectomy,
Okay.
and those who are older than 65 years old who have been undergoing pap smear ever since and have been getting normal results. Okay, so it doesn't make sense for you to continue on if you're above 65 years old already.
So there's another way to prevent, apart from vaccine, doing scanning. The last one is your actual lifestyle.
Yeah. So be faithful. Only have one.
Yeah.
Only have one partner, okay?
I think that's the step number 1.
That's step number 1. If it isn't there, then you won't have to worry about anything at all, right?
Yeah.
Okay. So number 2, what if you already are, okay? What if you already have, you already have mingled with a lot of people, right? So here's a study showing that in a population study, what is the relation of your immune system versus getting cervical cancer? Okay, so being a vegetarian actually does a lot of things in preventing this. Okay, so here in the study, they found that a non-vegetarian diet in a rural setting act as a significant independent predictor for HPV infection. Okay, so and many studies have also reported that vegetarians have lower risk of HPV infection because of the presence of phytonutrients from fruits and vegetables in their diet.
Wow.
Okay? Especially vitamin C, E, beta-carotene, and folate. And mind you, these 3 nutrients are also found in SimplyNaturePPARs. Actually, it's found abundantly, highly concentrated because SimplyNaturePPARs is a microalgae, and these microalgae are really packed with nutrients.
And I like what you said, phytonutrients, because that's what's missing from vitamin C, vitamin C capsules.
Yep.
And I love what you shared about COVID-19 treatment and prevention. We need to lower inflammation.
Yeah.
And what you need is from lifestyle, fruits and vegetables, not actually just your vitamin C capsules.
Yeah.
And of course, you can find that in our SimplyNature tablets.
Actually, here the occurrence of cervical cancer once you get infected with HPV, it actually is anchored in inflammation as well. So once you get infected, of course, your immune system will trigger the inflammation to kill off the virus. So that inflammation, repeated damage, that will cause the mutations of that part of your cervix, and then from there, once it is inflamed, so cells will die. Then it will heal itself repeatedly over and over again until the DNA gets damaged.
And that's where you get your cancer cell.
Yeah, that's when you get your cancer cell. So it's really because of the inflammation. So if you have these phytonutrients, then your risk of getting HPV will significantly drop. Getting cervical cancer will significantly drop even if you are infected already with HPV.
Okay. All right. Next.
Yeah. So here's another study again wherein they found that oncogenic HPV infections.
What's oncogenic HPV?
So this means that these are the HPV virus strains which causes cancer.
Okay.
So they assessed these women from baseline 3 months later and 9 months later. Okay, so higher levels of vegetable consumption were associated with a 54% decreased risk of HPV persistence.
Wow.
Okay, across that period. So you can just imagine. Okay, just by eating
vegetables. Wow.
You decrease your risk by more than half, right? Hi everyone, thank you for joining us today. If you want to have a consultation with me, just comment down below and our team will get back to you to set an appointment with me. So here is another study showing that a vegetarian diet really does wonders. So here they did not just study cervical cancer alone. They took into consideration breast cancer, your cancer from your vulva, cervical cancer. So for vegans, you actually decrease your risk by at least 40%.
Wow, that's amazing.
That's a big chunk of risk.
Okay, Doc, since we've talked about prevention, many of our viewers, I'm sure some of our viewers out there are actually patients who have cervical cancer. So what are your advice and knowledge that they need to know about staging, and also what are the treatments available and how they can do it successfully?
Yeah, so that's correct. Before you get treated, we have to know what stage you are in. So in order to find out your stage, we have to do some imaging studies. So you can go for your pelvic ultrasound, you can go for your transvaginal ultrasound. And if your doctor thinks that the cancer is more extensive, then we have to undergo a CT scan, MRI, or PET CT scan. Okay? So that is how we determine the extent of the cervical cancer. Now, the extent of the cervical cancer will determine your stage.
Okay.
So for stage 1, the tumor is confined to the cervix alone. Now, this list is a general approximation of each of the staging, no? But it is more complicated than this, which I won't go into more details because of time, okay?
Yeah.
So for stage 1, the tumor again is confined to the cervix alone. For stage 2, the tumor can extend beyond the uterus but has not extended onto the lower third of the vaginal canal or to the pelvic wall. Okay, so as you can see in the picture, all right? So for stage 3, the tumor will already involve the lower third of the vaginal canal, or extend to the pelvic wall, or cause hydronephrosis. So hydronephrosis is just basically the ballooning of your kidneys.
Ooh.
So you can just imagine the fluids from the kidneys actually drains their urinary bladder. Now once the tumor is impinging or obstructs
Like a dam.
Yeah, it's like a dam. So once it obstructs that ureter, then the urine will backflow.
Oh, all the way to
urine
the
will
kidney.
flow all the way to the kidney. So the kidney will what? Balloon. Because
Wow.
the kidney is elastic. Okay? So that is your hydronephrosis. So
So you can end up with dialysis for...
no, not really.
Okay, no, okay.
Unless both kidneys are impaired, then you have to
Go for
undergo some
dialysis.
dialysis or probably some surgical procedures. Okay, so another one for stage 3 is the involvement of the lymph nodes. So the para-aortic and your pelvic lymph nodes. Okay, so these can be detected only through CT scan or MRI or PET CT. Okay, and lastly, your stage 4, which is metastatic cervical cancer. So once it extends beyond the true pelvis, okay, once the true pelvis is, if you can feel your bone here in your waist, below that is a part of your true pelvis. Okay, so if it involves your bladder, your urinary bladder, your rectum, or it spreads to distant organs, let's say for example your liver or to your colon, no, then that becomes stage 4 cervical cancer already.
Doc, for all the listeners out there, so if you've been diagnosed with stage 1, stage 2, how should you be feeling? I mean, should you be like very worried, or is your treatment going to be something that you can be confident in?
Yeah, you can still be confident that your treatment will be successful if it's in stage 1 and stage 2, especially in stage 1, because the tumor is still confined to the cervix. So this can be treated by simple brachytherapy.
Wow, so for all the listeners out there who have only been diagnosed with stage 1, stage 2 cervical cancer, this is a confirmation. I'm sure your uncle has told you, but here Dr. Jansen is confirming it's okay. You're going to be okay.
Yeah. You're going to survive. You're going to live.
You're gonna do well.
Now,
but what about stage 3 and 4? I mean,
for stage 3 and 4, it will be more complicated since you have to undergo chemotherapy, radiation therapy, and surgery as well. To some extent, surgery.
Is cervical cancer the type of cancer that is aggressive and fast, or is it more like prostate cancer, which is slower?
It depends on the age.
Okay.
If the younger you are, the more aggressive it is.
Oh, this is the opposite.
It's the opposite. The
Okay.
younger you are, the more aggressive it is.
Okay.
The older you are, the more not really benign. The more slow growing it will be.
Is it because your reproductive organs are no longer in their prime?
No. It has something to do with the metabolism.
Got to do with your metabolism. All right.
Okay, so there you go. Now for the treatment, okay, so we have surgery, concurrent chemoradiotherapy using cisplatin, and brachytherapy. Now, we have to, for surgery, you have to talk with your oncologist if you qualify for one, because we don't operate on all cervical cancer patients. Okay. So next is, this one is more or less mandatory, but still depending on the stage of your cervical cancer. So that this is concurrent chemoradiotherapy. So what does this mean? While you're undergoing radiation therapy, you are also undergoing chemotherapy. Now, why do they do this?
Yeah, why both?
It's because if you do not put patients into, if you do not administer chemotherapy to cervical cancer patients, the cervix will not respond that much to radiation therapy. The cervix is not really that sensitive to radiation treatment. That is why you put in cisplatin in order for the cancer cells to multiply. It's to force the cell cycle in order for the moves to divide.
To stress the cancer cell.
Yeah, so to speak. It's more on to sensitize the cancer cells to radiation.
Okay.
Now, once these cancer cells are sensitized, then you kill them with radiation
Therapy.
Yeah, so that is how it works. So the most common chemo drug that they use for this is cisplatin. So cisplatin is also a radiosensitizer.
Oh, cisplatin is a radiosensitizer. That's something new I'm learning today. And the good news, right? The good news for all our listeners over there, our SimplyNature PPAR extracts are specifically tested with cisplatin, right? And we have found that it protects your bone marrow, your spleen from the damage from cisplatin. So this is the best news for all cervical cancer patients out there. Call us up right now, make an appointment, a consult with Dr. Jansen, because your primary treatment, which is cisplatin, is something our product is specifically tested for. And it works to protect you, so you won't have all the side effects. You minimize all your side effects from cisplatin. You do well for your chemo, and you'll come out clear. Yes.
Correct.
Very exciting.
Yeah, this is.
I was so happy when I saw the slide. It says cisplatin. I said, "Wow, that's exactly what we tested our product on."
When I was still an intern back in St. Luke's Medical Center, I've rotated in the radiation oncology department as well. So I've observed a lot of brachytherapy cases. So
what is brachytherapy?
Brachytherapy is just another mean of short-range radiation treatment.
Okay.
So usually, what we do for radiation therapy is that you lie down on a sort of like a stretcher, right? You lie down there. Then there's it looks like a flashlight, but it's not really a flashlight. When you just lie down, then the radiation is shot through your body.
Okay.
So yeah, it looks like a flashlight, but of course you cannot see the light, of course. But so that is your external beam radiation therapy. Brachytherapy is different. So brachytherapy is wherein they insert a rod, wherein they put in the radioisotope in order to irradiate that.
So it's more
area.
localized.
It's localized. It's a
more
localized
localized.
treatment. So brachytherapy is used to treat cervical cancer and prostate cancer as well. So that is what they do. Okay? And of course, if you are thinking, hey, would this be very bad for my body? I mean, you are simultaneously administering chemotherapy and radiation therapy to my body. Won't I die from it? You won't die. You will not die from this, but you will be very, very weak. I've seen a lot of cancer patients undergoing this. They're really thin. They're really weak. So my advice to you, if you are currently undergoing one right now, take SimplyNaturePPARs, because the SimplyNaturePPARs will be able to protect the other parts of your body, like your bone marrow, especially your bone marrow, because the white blood cell count is a very important issue here.
Especially for recurrence.
Yeah, especially for recurrence, and your immune system largely depends on your WBC count. Another one is your hemoglobin. Because of course, the bone marrow is where our red blood cells develops, right? So if the bone marrow is destroyed, then the amount of red blood cells produced by our bone marrow also decreases as well. So that is also a concern, because aside from it being a carrier of oxygen, which also determines the effectiveness or the effectivity of your radiation therapy. Of course, you might also have some symptoms of bleeding, spotting, which of course that is blood loss as well, no? So yeah, SimplyNaturePPARs does wonders for this.
If a person wants to like try naturally, I mean, is there like, okay, you want to try, you try for 2 months. If it doesn't work, then you better go. I mean, is there a time frame you would say they can try?
You can afford to do it if it's stage 1.
Okay.
You can afford to do it if it's stage 1, but you have to realize, no, you have to accept one way or another, if the current treatment, the current natural treatment is not working, then you have to use all of these modalities. So how long would you wait? I'd give myself 6 months.
Okay. Very clear guidelines, all right? So those who want to treat yourself naturally, you're in early stage 1 or cervical cancer, maximum 6 months. But doc, definitely they need to go and monitor themselves to make sure it doesn't get worse, right?
Right.
All right. And because the reason again, because the chemoradiotherapy will work.
Yeah.
Right? It will cure you because you are stage 1, stage 2. But I know you just want natural, so 6 months. After that, go for it. And here's the good news. The cervical cancer treatment uses cisplatin. And SimplyNaturePPAR is tested with cisplatin.
Yeah.
So good, right? We can reduce the majority of the side effects. Dr. Jansen's patient is shopping even though she's going through chemo. No hair loss.
No. She did that loss here.
Any hair. That's great news to all the women out there, right? So I think today's program is fantastic, Doc. First time I heard you give a clear, you can try natural for 6 months, but after that, no.
You have to go for...
You go for this one. And this one is 100% you're going to get well. And we have the SimplyNature PPARs that will prevent all the side effects and complication, and to also prevent you from having recurrence. So right now, take action. Arrange for a Simply consult with Doc Jansen so that you can confirm. If you want to go natural, he will start the 6-month clock. All right, and then he'll follow up with you. If not, you'll be going for the treatment. He'll support you through your chemotherapy so that you have no side effects and you'll do so well, like his other clients. All right.
Yeah.
All right. So if not, Doc, let's move to the Q&A.
Right.
All right, let's go to live Q&A right now.
Hello mga ka-Simply Nature! Please follow our social media accounts, our Facebook page, Simply Nature International, our IG account, Simply Nature Inc., and of course, our YouTube channel, Simply Nature. Don't forget to subscribe and click the notification bell for more updates.